Hey, Alpha Nurses, I'm Licensure from alphanursguide.com. This is 10 practice NCLEX questions. Without delay, let's get started.
The nurse is discussing oral glyburide with the client diagnosed with type 2 diabetes. Which information should the nurse discuss with the client? 1. Instruct the client to take the oral hypoglycemic medication with food. 2. Explain that hypoglycemia will not occur with oral medications. 3. Tell the client to notify the HCP if a headache, nervousness, or sweating occurs. 4. Recommend that the client check the ketones in the urine every morning. The correct answer is 1. Instruct the client to take the oral hypoglycemic medication with food. Glyburide is a sulfonylurea that stimulates the pancreatitis to secrete more insulin. The oral hypoglycemic medication should be administered with food to decrease gastric upset. The client receiving oral hypoglycemic medications can experience hypoglycemic reactions, as can clients receiving insulin. In option 3, these are signs or symptoms of hypoglycemia, and the client should be able to treat this without notifying the HCP. Ketones are a byproduct of the breakdown of fats, which usually does not occur in clients with type 2 diabetes because the client has enough insulin to prevent breakdown of fats, but not enough to keep the blood glucose level within an acceptable level.
A nurse identifies that a client in middle adulthood is experiencing a developmental crisis. Which of the person's behaviors supports this conclusion? Select all that apply. 1. Unable to mentor children in the next generation. 2. Difficulty in developing peer relationships. 3. Inability to achieve feelings of success. 4. Incapable of delaying satisfaction. 5. Failure to face eventual death. The correct answers are 1. Unable to mentor children in the next generation, and 3. Inability to achieve feelings of success. Rationale. A task associated with middle adulthood is sharing of self and performing activities that promote the growth of others, particularly those in the next generation. A major task of middle adulthood is successfully fulfilling lifelong goals that involve family, career, and society. If these goals are not achieved, a crisis often is precipitated. Developing peer relationships is one of the developmental tasks of the 6 to 12-year-old child and adolescent, not the middle-aged adult. Delaying satisfaction is one of the developmental tasks of the 18-month to 3-year-old child, not the middle-aged adult. Facing death is one of the developmental tasks of the 65-year-old and older adult, not the middle-aged adult. A nurse determines that, according to Erickson, establishing relationships based on commitment mainly occurs in which stage of psychosocial development? 1. Middle-aged adulthood. 2. Young adulthood. 3. Adolescence. 4. Infancy. The correct answer is 2. Young adulthood. Rationale. Young adults, 18 to 25 years. Intimacy versus isolation. Strive to establish mature relationships, commit to suitable partners, and develop social and work roles acceptable to society. Unsuccessful resolution results in self-absorption, egocentricity, and emotional isolation. Middle-aged adults, 25 to 45 years. Generativity versus stagnation. Strive to fulfill life goals associated with family, career, and society, as well as to give to and care for others. Adolescents, 12 to 20 years. Identity versus role confusion. Strive to make the transition from childhood to adulthood with a sense of personal self. Infants, newborn to 18 months. Trust versus mistrust. Strive to have their needs met through interacting with others. When their needs are consistently met, they develop a sense of trust in their caregivers. A nurse is planning a teaching session for an older adult about a prescribed medication regimen, which is a major concern about older adults that the nurse should consider. 1. They experience an increase in absorption of drugs from the gastrointestinal tract. 2. They are less motivated to follow a prescribed drug regimen. 3. They are less likely to learn due to a decline in intelligence. 4. They have a decreased risk for adverse reactions to drugs. The correct answer is 2. They are less motivated to follow a prescribed drug regimen. Rationale. The literature documents that older adults are at high risk for non-adherence to a medication regimen because of its complexity. The larger the number of medications and the larger the number of doses per day, the higher the risk of non-adherence. One study indicated that the adherence rate was 87% for daily dosing, 81% for doses twice a day, 77% for doses 3 times a day, and 39% for doses 4 times a day. Other reasons for not fully adhering to a drug regimen include inconvenience, side effects, financial limitations, and/or perceived ineffectiveness of the drugs.
Which instructions for a child diagnosed with encopresis should the nurse question? Select all that apply. 1. Limit the intake of milk. 2. Offer a diet high in protein. 3. Obtain a complete dietary log. 4. Follow up with a child psychologist. 5. After dinner, have the child sit on the toilet for 10 minutes. The correct answers are 2. Offer a diet high in protein, and 4. Follow up with a child psychologist. A diet high in protein will cause more constipation. The child and family would not be encouraged initially to seek counseling unless a psychological component to the encopresis had been identified. Dairy products are limited because they can lead to constipation. A complete dietary log should be kept to correlate the foods that lead to constipation. Children with constipation/encopresis are advised to sit on the toilet for 10 minutes after dinner to take advantage of the gastrocolic reflex. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions.
A hospitalized client who is being treated for hypertension with furosemide, atenolol, and ramipril develops a second-degree heart block Mobitz type 1. Which of the following actions should the nurse take? 1. Administer a 250 milliliters fluid bolus. 2. Withhold atenolol. 3. Prepare for cardioversion. 4. Set up for an arterial line. The correct answer is 2. The client may be asymptomatic, and the underlying cause should be assessed. Drugs that block the AV node should be avoided, such as beta blockers, calcium channel blockers, digoxin, and amiodarone. Symptomatic clients are treated with atropine and transcutaneous pacing. There is no indication for a fluid bolus, cardioversion, or arterial line.
The nurse is caring for a 2-year-old child who was admitted to the pediatric unit for moderate dehydration due to vomiting and diarrhea. The child is restless with periods of irritability. The child is afebrile with a heart rate of 148 and a blood pressure of 90/42. Baseline laboratory tests reveal the following: sodium 152, chloride 119, and glucose 115. The parents state that the child has not urinated in 12 hours. After establishing a saline lock, the nurse reviews the physician's orders. Which order should the nurse question? 1. Administer a saline bolus of 10 milliliters per kilogram, which may be repeated if the child does not urinate. 2. Recheck serum electrolytes in 12 hours. 3. After the saline bolus, begin maintenance fluids of D5 normal saline with 10 milliequivalents potassium chloride per liter. 4. Give clear liquid diet as tolerated. The correct answer is 3. After the saline bolus, begin maintenance fluids of D5 normal saline with 10 milliequivalents potassium chloride per liter. Potassium is contraindicated because the child has not yet urinated. Potassium is not added to the maintenance fluid until kidney function has been verified. The child with dehydration secondary to vomiting and diarrhea is placed on a clear liquid diet. Fluid boluses of normal saline are administered according to the child's body weight. It is not unusual to have to repeat the bolus multiple times in order to see an improvement in the child's condition. It is important to monitor serum electrolytes frequently in the dehydrated child. The nurse in the medical unit has received the morning report. Which medication should the nurse administer first? 1. Pantoprazole to a client on call to surgery. 2. Calcium carbonate to a client reporting indigestion. 3. Bismuth to a client diagnosed with an ulcer. 4. Famotidine to a client diagnosed with gastroesophageal reflux disease. The correct answer is 1. Pantoprazole to a client on call to surgery. Pantoprazole is a proton pump inhibitor. A medication for a client on call to surgery is a priority. The client's surgery could be delayed if the medication has not been administered when the call to surgery comes. Calcium carbonate is an antacid. This would be the second medication to administer, as this client has a report of discomfort. Bismuth is an antimicrobial. This medication is a routine medication and could be administered at any time. Famotidine is an H2 blocker. This medication is a routine medication and could be administered at any time.
The nurse is teaching a client with hypertension about taking atenolol. The nurse should instruct the client to 1. Avoid sudden discontinuation of the drug. 2. Monitor the blood pressure annually. 3. Follow a 2-gram sodium diet. 4. Discontinue the medication if severe headaches develop. The correct answer is 1. Atenolol is a beta-adrenergic antagonist indicated for management of hypertension. Sudden discontinuation of this drug is dangerous because it may exacerbate symptoms. The medication should not be discontinued without a physician's prescription. Blood pressure needs to be monitored more frequently than annually in a client who is newly diagnosed and treated for hypertension. Clients are not usually placed on a 2-gram sodium diet for hypertension.
A nurse is doing a newborn assessment on a new admission to the nursery. Which of the following actions should the nurse make when evaluating the baby for developmental dysplasia of the hip? Select all that apply. 1. Grasp the baby's legs with the thumbs on the inner thighs and forefingers on the outer thighs. 2. Gently adduct and abduct the baby's thighs. 3. Palpate the trochanter during hip rotation. 4. Place the baby in a fetal position. 5. Compare the lengths of the baby's legs. The correct answers are 1. Grasp the baby's legs with the thumbs on the inner thighs and forefingers on the outer thighs. 2. Gently adduct and abduct the baby's thighs. 3. Palpate the trochanter during hip rotation. And 5. Compare the lengths of the baby's legs. With the baby placed flat on its back, the practitioner grasps the baby's thighs using his or her thumbs and index fingers. When assessing for Ortolani sign, the baby's thighs are abducted. When performing the Barlow test, the baby's thighs are adducted. With the baby's hips and knees at 90-degree angles, the hips are abducted. With developmental dysplasia of the hip, the trochanter dislocates from the acetabulum. The nurse would feel the dislocation while palpating the trochanter. Legs are extended to assess for equal leg lengths and for equal thigh and gluteal folds. When performing both the Ortolani and Barlow tests, the baby is placed flat on his or her back. When assessing for symmetry of leg lengths and tissue folds, the baby is placed in both the supine and prone positions. The order of the steps of the Ortolani procedure is 1. The nurse places the baby on the baby's back. 2. The nurse grasps the baby's thighs with a thumb on the inner aspect and forefingers over the trochanter. 3. With the knees flexed at 90-degree angles, the hips are abducted. And 4. The nurse palpates the trochanter to assess for hip laxity. The Barlow test is performed by 1. Adducting the baby's legs. 2. Gently pushing the legs posteriorly. And 3. Feeling to note any slippage of the trochanter out of the acetabulum. Galeazzi sign, to assess for uneven knee heights, can also be performed. You can get the NCLEX Mastery Bundle now, link is in the description, or you can get it at alphanurseguide.com.